Ready?
Yes. Okay. This can be highlightable, isn't it?
Yes. Mm-hmm.
Okay. A 32-year-old man, sorry, a 32-year-old woman. I don't know why I do these type of mistakes. Okay. 32-year-old woman, gravida 3 para 2 comes to the physician with a prenatal visit. Her last menstrual period was 17 weeks ago. Her last menstrual period was 17 weeks ago. Examination shows a uterine fundus that is palpated midway between the pubic symphysis and the umbilicus. Her serum alpha fetoprotein is 2.6 multiples of the median. Which of the following is the appropriate next step in the management?
Mhm. What does that mean? That is high or that is low?
Isn't it high?
Okay, is that what it means? Okay.
Mm, Like serum alpha fetoprotein is high.
Mhm.
Alpha fetoprotein is P-man, hepatocellular addiction, allergy addiction.
Ready?
1 second, 1 second.
Mhm.
Okay,
Ultrasound. Ultrasound to evaluate. Why is it so little? Oh, yes. Ultrasonography to evaluate the fetus is the most appropriate next step with an increased alpha fetoprotein concentration in the maternal serum. The most common causes of increased alpha fetoprotein include an inaccurate gestational date, multiple gestation, abdominal wall defects like gastroschisis, omphalocele, and neural tube defects as anencephaly, spina bifida. Ultrasound will allow the clinician to better delineate the gestational head of the fetus and to rule out multiple gestation. It will also identify the abdominal or neural tube defects. Amniocentesis can also be performed after ultrasound to assess the amniotic fluid acetylcholinesterase, which will further indicate an underlying neural tube defect. A repeat measurement of serum alpha fetoprotein concentration could be considered if there was a concern for a false positive result, given the patient's result of an alpha fetoprotein concentration that is 2.6 multiples of the median, of false positive is unlikely. You want
can
me to
you
read
read
another?
the, yes, amniocentesis?
Amniocentesis is an invasive sampling of amniotic fluid through the abdominal wall, usually performed at 15 to 20 weeks gestation. It may be considered after ultrasound to further assess the presence of a neural tube defect through detecting the presence of amniotic fluid acetylcholinesterase.
So
However,
amniocentesis is the next step.
um, not, oh, I guess here you can see it like that. However, ultrasound is a better initial diagnostic evaluation as amniocentesis is invasive and can result in complications such as fetal maternal hemorrhage, premature rupture, and choreamniocentesis. I guess, uh, yeah, I guess you can say it's the next step. Mhm.
Okay. Alpha
Next.
fetoprotein high is the He-man, isn't it? Like hepatocellular carcinoma, endodermal
Uh-huh.
sinus tumor, mixed germ cell tumor, ataxia telangiectasia, and neural tube defect.
Mm-hmm.
Okay, I'm recalling my mnemonic. Okay,
Yeah.
a 16-year-old girl, a 16-year-old girl is brought to the physician by her mother. She has never had menstrual period. She had never had menstrual period. She has had moderate lower abdominal pain last 5 months. She has no history of illness, takes no medication. She is 163 centimeter tall, weight 52 kg, BMI 20. Breast development is standard stage 4. Examination shows coarse pubic and axillary hair. Coarse pubic and axillary hair. External genitalia are normal. Vaginal canal cannot be visualized. Rectal examination shows anterior tender and central mass. Which of the following is most likely explanation for these findings?
Ready?
Yes, is it imperforate hymen?
That's what I picked.
Okay.
Okay. Simplified is a common congenital disorder where the hymen opening is absent, leading to obstruction of the vaginal canal and preventing the excretion of menstrual blood. Imperforate hymen presents with amenorrhea, cyclic pelvic pain, and bulging pelvic mass in an adolescent with otherwise normal sexual development. Significant accumulation of menstrual blood products may give the bulging hymen a blue appearance and may be palpated to the rectum. Condition known as hematocorpus. Diagnosis is made by ultrasound. Imperforate hymen is treated with surgical hymenotomy and evacuation of the accumulated blood. Next.
Okay.
I like
32,
those.
yes, 32-year-old woman, gravida to para 118 weeks of gestation comes for a routine prenatal visit. Ultrasonography shows a triplet gestation, show no abnormalities. all all three fetuses have fetal heart tone and are appropriate in size for gestational age. For which of the following complications are at increased risk?
Okay. Ready?
Yes, yes.
Premature labor. Premature labor is a common complication of multiple gestation pregnancy. Other complications include intrauterine fetal growth restriction, twin transfusion syndrome, and fetal malpresentation. Preterm labor occurs between 20 to 37-week gestation with regular uterine contractions and accompanied by cervical change. As preterm delivery is associated with high degree of fetal morbidity and mortality, is usually treated with oncolytic therapy, hydration, and bed rest. Steroids are also given to promote fetal long maturation if the gestational age is less than 34. It's not abrupt placenta commonly presents with severe uterine pain, vaginal bleeding, and tetanic contraction, most commonly in the third trimester. Risk factors include hypertension, preeclampsia, cocaine use, abdominal trauma. Multiple gestation is not a risk factor. It is not oligotramnios, describes inadequate amount of amniotic fluid that can cause flow restriction and structural abnormalities of the fetus. Causes include premature rupture of membrane, uteroplacental insufficiency, congenital malformation of the fetal JU tract, posterior urethral valve, and renal agenesis, and is not associated with multiple gestation. Non-placenta previa classically presents with painless vaginal bleeding during the third trimester due to placenta that partially or totally overlies the cervical os, while a multiple gestation present pregnancy is a risk factor for development of placenta previa. Premature labor is generally a more common complication. Polyhydramnios is an excess amount of amniotic fluid, which can cause abnormalities in fetal presentation, breech, footling presentation, cord prolapse with rupture of membranes, preterm labor. While multiple gestation pregnancy can cause polyhydramnios, it is generally less common than preterm labor in triple gestation. Next.
A 37-year-old woman gravid to para 1, 36 weeks of gestation, admitted to the hospital. Uh, she was found to have fetal growth restriction during routine prenatal visit. Fetal growth restriction. She has 6-year history of chronic essential hypertension with beta adrenergic blocking agents that were discontinued 8 weeks of gestation. At 10 weeks of gestation, a 24-hour urine collection show a protein concentration of 50 milligram and a creatinine concentration is 110 ml per minute. Ultrasonography and amniocentesis at 18 weeks of gestation show no abnormality, and the estimated fetal weight was at 50 percentile. Temperature today is 36.6, pulse is 88 per minute, respiration 20 per minute, BP 110 by 70, examination show fundal height 30 centimeter. Ultrasonography show fetal head circumference size with 35 weeks of gestation. An abnormal circumference is consistent with the site of 30 weeks of gestation. The estimated fetal weight is ninth percentile. Which of the following is the most appropriate next step to determine the intrauterine fetal device?
Ready?
Okay, yes.
Fetal growth restriction is Doppler ultrasound of the umbilical artery. Sorry. Fetal growth restriction occurs when the fetus fails to reach its full genetic growth potential due to variety of maternal, fetal, and environmental factors. Fetal growth restriction is defined as an estimated fetal weight less than 10%, and is classified as asymmetric or symmetric. In cases of symmetric, there is restriction of growth of the fetal head, abdomen, and extremities, indicating continual impairment of fetal growth from early stages of gestation. Causes of symmetric fetal FGR include intrauterine infection, chromosomal abnormality, maternal drug or toxin exposure. In cases of asymmetric FGR, there is normal development of the head with restricted growth of the fetal abdomen and extremities. Asymmetric FGR typically occurs in the third trimester form. Causes such as maternal hypertension, CKD, preeclampsia, smoking. Asymmetric FGR is the more common pattern and is usually late onset, often as a consequence of placental insufficiency. Fetuses and newborns affected by FGR are at increased risk of intrauterine fetal demise. This fetus displays evidence of asymmetric FGR, which is best evaluated by Doppler ultrasound of the umbilical artery to assess for fetal well-being in the third trimester. Doppler ultrasound can be used to evaluate the umbilical artery waveform to assess for placental insufficiency. And it has been shown to decrease perinatal morbidity and mortality. It is not B. Fetal fibronectin test is performed via vaginal swab and indicates leakage of fibronectin, a glycoprotein that is produced in the interface between the choriamnion and the uterine decidua. Leakage of fetal fibronectin indicates an increased risk of impending preterm labor. Okay. And it's not, wait, which one? E. Determination of amniotic fluid glucose concentration. It's useful to identify gestational diabetes and amnionitis. It's not useful for fetal growth restriction. Okay.
Okay.
Next.
A 23-year-old woman a 23-year-old woman comes to the physician because of 3-day history of pain and burning sensation. 2 years ago, she had similar symptoms that resolved with trimethoprim sulfamethoxazole therapy. She is sexually active and uses Oral contraceptives, her temperature. Her temperature is normal. Examination shows no costovertebral angle tenderness. Urine analysis show bacterial pus. She requires advice preventing the future episodes. Which of the following is the most appropriate recommendation?
Hmm. Ready?
She's so okay.
Voiding immediately after intercourse. Lower UTI, present with dysuria frequency, urgency, and suprapubic discomfort. They occur more frequently in women than in men because of shorter urethra and fibroid region. We know that. These factors include the presence of urinary catheter, anatomy, GU defects, diabetes, pregnancy, and frequent or recent sex. Urinalysis will typically show bacteriuria, white blood cells, positive leukocyte esterase, positive nitrates, depending on the bug. Treatment of uncomplicated UTI typically consists of outpatient antibiotic management with TMP-SMX, tetrofurantoin, or cephalexin. Preventive measures for UTI include voiding after sex, oral hydration, and improvement of feminine hygiene practice to reduce the introduction of bacteria um, to
Can
the
you read
urethra.
the option C?
Yep. Antibiotic prophylaxis only after coitus or daily TMP-SMX prophylaxis are adequate regimen to prevent recurrent UTI infection. However, as this patient has only had two UTI in 2 years, voiding after coitus would be a better initial option for preventing recurrence without the risk of antibiotic side effects.
So recurrent
Mm,
UTI is within 6 months, 2, or within 1 year, 3.
yeah, I think so. Yeah. No preventive measures where it's not correct, as there are a number of behavioral and medical interventions that have been taken to it. Okay,
So
next.
why people take cranberry juice? As it
I
has no effect.
um drinking 6 ounces of cranberry juice daily has not been shown to decrease the. I I
Have you
I know.
have you seen any prescription in
Yeah.
our country? People actually give cranberry juice for UTI.
Me too. No prescription, no, but people say, okay, just take it, whatever. I never, it's never been prescribed
I
by
have
my
seen
doctor.
prescription too.
No, Lord, no. I've seen like, and usually I've seen it for like young people that have UTIs, like kids that have UTIs, like people who say
Yes,
give them
they actually
Sabina.
think that this is the
Yeah,
remedy.
yeah. But I don't think they think this is. I think they think that okay, it will like prophylaxis, like it won't. I don't think they. But yeah, I've heard it a lot. I've heard it a lot. Yeah, that's true.
So
Heard
it
it
has
a
no
lot.
beneficial effect.
It really has no beneficial thing.
47-year-old woman comes to the physician follow-up examination 6 weeks ago. She underwent total abdominal hysterectomy, bilateral salpingophorectomy for leoma mammary. Mm, Abdominal pap is abnormal. She has no history of abnormal pap test. She has no history of abnormal pap test. Examination today show well healing incision. Which of the following is the most appropriate next step regarding future pap smear for this patient? So, uh, she no previous pap smear positive, isn't it?
Mm-hmm.
And she has nothing. Oh, wonderful. Why you are choosing 3 years?
I'm not. I don't have an idea on this question. I'm
We
not.
uh,
I'm not
uh,
waiting. But I don't have an idea on these
like
questions.
okay, you have the idea. I am giving you the idea. Last yesterday or day after yesterday,
Mm-hmm.
we are talking about the cervical cancer screening. Do
Mm-hmm.
you remember? And you said that 21 to 50 every three
Mm-hmm.
years. But on that thing, if somebody has TAH and BSO, like he has nothing, like he has no uterus, no ovary, and previous PAP is normal. So what you will do? Now you think like you need the thing for infection, isn't it?
Mm, mhm.
And you have no previous history. Then
So you think like no longer indicated? Is that what you say?
yes, I'm trying to say that.
Okay, no longer indicated. Okay, let's go with no
No,
longer
no,
indicated.
I'm trying to make you convinced by my logic.
By your logic, okay, I'm convinced because I'm convinced. It's, I'm convinced. I
No,
believe
we
you.
have discussed this thing. Uh, do you remember?
I remember. I just don't remember when. Like I remember it was
You
21 to
told me
65.
to remember the 21 to 50 and every three
Yeah.
years.
Yes. But
Cytology every
yeah.
3 years. Cytology every
Uh-huh.
3 years or PAP. These things are written on there. Okay, leave it and then, okay.
Let's see. No longer indicated. You are right. That's why I believe you. It's like once you start, that means you know what you're talking about. Perhaps me
No, no,
testing and
what we studied, I try to recall that. That's why I
mm.
talk too much and try to try to remember because I whatever we have studied, these things actually keep in my memory. But the whole day I sit in my table and do nothing. I saw rain, I saw everything.
Perhaps me testing
Maybe I'm
employees.
going crazy actually.
No,
Okay,
please don't go crazy. Wait until after the exam and then you can go crazy. Rapid testing employs a cervical swab to collect cells from the transformation zone of the cervix and is an important screening tool for the detection of cervical cancer. The US PSTF guidelines recommend screening for cervical cancer with pap smear testing alone every 3 years in women 21 to and 29 years of age, between 21 and 29. Pap smear testing is also recommended every 3 years in women 30 to 65, so
65,
21 to 65
65.
of age, or every 5 years if co-testing with HPV is also performed. Total abdominal hysterectomy involves the surgical removal of the uterus and the cervix. Oh. Patients who have undergone these procedures for a benign indication, such as fibroids, no longer require cervical cancer screening with pap smears because they no longer have a cervical tissue. Makes sense. It's not, do I need to read the other ones? I guess. Okay. Screening every 3 years is recommended for women between 21, 29. Screening every 3 years also recommended, okay, if co-testing. However, this is not appropriate after abdominal hysterectomy for a benign indication, as the patient no longer has a cervix.
Okay.
Yeah, I think that's it. Okay, next.
A 27-year-old woman comes to the physician because of 4-month history of increasingly severe pain during menstrual period. Mens occur at regular 28 days interval, last 5 to 7 days with a light flow. Her last menstrual period was 25 days ago. She underwent loop in electrosurgical excision of the CIN, cervical in transformation zone for cervical dysplasia 6 months ago. Examination of the biopsy specimen showed CIN2 with negative margin. She is sexually active, uses condoms and spermicidal foam. Pelvic examination shows normal vagina and normal scarred cervical os. The uterus is slightly enlarged and tender. Which of the following is most likely cause of this patient's symptoms? Are you there?
Yes, I'm thinking.
Very silent.
Yes,
That's why.
Jesus, sexually active and youth is conduct, traffic exemption number, budget, blah blah.
CIN done. Think about on that way.
Permissive recurrent display
There was a
using
box.
is you and your boxes. You and your boxes.
I'm
Why
very
did
crazy with the boxes because
you
I found if I know the boxes, then one answer is correct. But it is very hard to find it out the answer through the boxes. Okay,
ready?
you are convinced with endometritis. Why?
Not really.
Why is that?
Endometritis will have fever. That doesn't make sense. Space, blah 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 blah. Pelvic exam. No, it's not endometritis. Recurrent dysplasia. Pain during blah blah blah. No,
Okay, let.
threaten about.
I
I don't
don't
know if
think that it is endometritis.
I don't
Think
think so. Cervical stenosis. Oh, sorry, never mind. What else will cause a tender enlarged uterus?
why you
Oh,
are looking at the tender enlarged uterus. Why you are not focusing on the CIN? Like, sorry, why you are not focusing on the like lip, loop, electrosurgical excision? These things actually takes your like takes the part of the cervix from the transformation zone.
okay.
So then it cause the narrowing.
Mm-hmm.
Okay,
Okay. Let's see.
it is
Oh,
cervical stenosis. I am trying to make you clue.
I understood, but I was like, how is that causing increased pain and
If
doing the?
something is getting narrow,
Uh
then
huh.
it can cause pain. Okay.
Oh, so.
Cervix. Sorry. Okay.
Oh, you want to read it
No,
first?
no, no. You read it. I forgot.
Okay. Cervical stenosis is caused by scar tissue narrowing the cervical os. Okay. A manifestation may include dysmenorrhea or cyclic pelvic pain. Oh, with life-loading menses. As in this patient, symptoms are caused by the obstruction of menstrual flow through the cervix. Okay, retrograde or stagnant flow of menses may lead to enlarged and tender uterus containing blood products, hematometra. Oh, and increased risk of endometriosis. Amenorrhea, infertility, and recurrent pregnancy loss may occur if the scarring extends into the uterine cavity. There are many potential causes of cervical stenosis. Any cause of cervical inflammation, such as endometriosis, radiation, chronic infection, trauma. Previous instrumentation, as in this case, can cause erosion of the cervical epithelium, which heal by forming a scar. Gradual dilation of the cervix may be effective treatment of the cervix. Okay, so it's painful because the period cannot come out normally. Okay, got it. Didn't know that.
Okay.
Next.
Okay. We can do the 5 questions
Oh, sorry, forgot. Yeah.
because we are getting late.
Okay, what was that? I think I saved
Uh,
that somewhere.
like 1 to 5 measures of disease occurrence.
I think I downloaded them yesterday. Where is it? This one.
I think
I
that
don't.
it will be helpful. You
Okay,
okay?
you're the one taking the exam soon. So yeah, if you need to, with whatever
You
you feel like we need to do, we do it. Okay, let me close this so you don't see it. Okay,
okay?
so this
No,
one.
we are actually doing for us, not for me
Yes,
only.
yes.
Like
But you know, if you like, I feel like if you pass the exam, it will motivate me. I'll be like, no, seriously. That's why I'm like,
I'm very bad at that.
I feel, yeah, I feel like, I'll be like, I was studying with him. If he passed, there is no reason I should have passed. Like, yeah, I'm probably passing too. So that's why I'm like,
You are a
yeah,
very good
whatever you do.
student, but you don't know it. That is the problem. And maybe you are. with such a people that nobody admires you. Actually, what happens in the life, that is my philosophy. Maybe you may think like I'm crazy, but my philosophy is like, if you push somebody, then he can push you and we can go
Mm-hmm.
together. Like, it is, the journey is very tough. You have to
Mm-hmm.
know that this journey is very tough. If we don't push together, then the good thing will not gonna come.
Yes.
If we think that I have to do it, whatever he will do, what is, I don't care about that. I don't think like that. I think like, it is us and we can inshallah make it. That's my philosophy. So
That's a good philosophy.
I may not pass, you may got pass. So just give your best. Inshallah, you
Mm-hmm.
can do it. You are a very
Yeah.
good student, and you are
Thank you.
very uh, you are very like regular, and this is
Mm-hmm.
actually important in the life. Regularity is very important. I sometimes try to skip because I am crazy. Okay.
Ah. Go.
Okay, I am reading the there is 5 questions and then the
Uh-huh.
explanation in the biostat. This is like that. Okay.
Mm-hmm.
A new comorbid chemotherapy and immunotherapy regimen has been shown to significantly prolong cervical in patients with metastatic melanoma. If widely implemented, which of the following changes in disease occurrence measure would you most expect? Like prolonged prolonged survival in if prolonged survival, immunotherapy, chemotherapy regimen, prolonged survival. So incidence decreases. Prevalence. Oh, not gonna. Okay, what
Okay.
is your answer?
D as in dog.
Yes, I am thinking so. Like, incidence will not gonna change. The prevalence will increase. Okay.
Okay. So do I look at the answers
No, no,
or do I?
not now. After
Okay.
doing 5 questions.
Okay. Got it.
Okay. The incidence of the incidence of the diabetes mellitus with very little migration has remained stable over the past 40 years, 55 cases per 1,000 per year. At the same time, prevalence of the disease increased threefold over the same period. Which of the following is the best explanation for the changes in diabetes occurrence measures in population? Okay,
Okay.
next. In a survey of 10,000 IV drug abuser town A, 10,000 IV drug abuser in a town A, 1,000 turned to be affected with hepatitis C, 1,000 turned to be hepatitis C, and 500 infected with hepatitis B. During 2 years of the follow-up, 200 patients with hepatitis C and 100 patients with hepatitis B die. Uh, uh, Also, during the follow-up, 200 IV drug abuser acquired hepatitis C, 200 drug abuser hepatitis C, and 50 acquired hepatitis B. Which of the following best estimate the annual incidence of hepatitis C? Hepatitis C. Hepatitis C is number of the new cases, isn't it? Incidence,
Mm-hmm.
Number of the new cases divided by total number of the population.
Probably, yeah.
The type 100.
Representation. Two hundred. So it's Jesus. Okay. So 200 acquired hepatitis C. 200 out of the. It cannot be that. 200 out of the 700. Nope, it cannot be that. So it's new cases. Oh, my lord. 1,100. No.
This is simple question, but we are not getting the answer. Incidence
Yeah.
prevalence, we have to get it, isn't it?
Yeah. No new ones died. 200.
Okay, we can make it out like 200 new cases, but 100 people died. So 200. I will.
Okay. Next, just pick one. Let's go. We'll check the answer.
Okay, 100 out of the 1,000. Okay. The following graph of the vaccination rate dynamics hepatitis B IV drug abuser in town A. Which of the following hepatitis D statistics are to be affected the reported data? Hepatitis B IV trauma.
Is most likely to affected by the reported
One.
data. Mhm. Okay.
Okay. Number 5. In a city, having a population of 10,000, 100,000, there will be 300,000 women of childbearing age. The following statistics are reported for the city in year 2000. Fetal death is 200, live birth is 5,000, maternal death is 70. Um, which of the following is the best estimate is the maternal mortality rate? Okay,
Mm, 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 mm. Okay. Ready for the answer?
yes, okay,
The one is D as in dog. Oh, but it doesn't give us the explanation, right? It just gives you the answer.
no, no, they will give the explanation in a whole, like start reading. You want me to read the, okay, I'm reading,
But
like
where is it? What is it?
go downwards, yes.
Oh, okay, okay, okay. I was like, wait, where
Yes,
is the
it
explanation?
is the skin who has given it. It is the what can I say, screen capture, like I have told you to screen capture.
Uh-huh.
It is the screen capture, so it is below. Okay, you start reading from the incidents.
Where? Where do you see from the incidents?
Yes,
I
this
right
one.
here.
Yes, yes,
Oh,
you
okay.
will get all
Oh,
the answers, but it is written as a whole.
oh, I don't like this. Ah,
You can do
okay.
anything.
Incidence measures new cases that develop in a population over a certain period of time. It is important to define the period of time during which the number of new cases is counted. Weekly incidence versus annual incidence. Incidence does not take into account the number of cases that already existed in the population before the counting period began. Okay. It is also important to include in the denominator only the population at risk of acquiring the disease. For example, in question number, you see, they are in question number 3, we're in question 1.
Okay, well, no problem. Go to the number 3.
Oh, that was number 3. So how, okay, so 1, that means that we got it. We just move on to, we done with 1.
Yes, we know
Okay.
1 and 2 we can explain. The problem will start with 3. You will get all the thing. You just keep reading.
Okay. Okay. Question number 3, IV drug abusers diagnosed with Hep C infection before the follow-up period began should be excluded from the denominator because they already have the disease and thus are no longer at risk. So 10,000 minus 1,000. What is 10? So 10,000.
Minus 1000.
But what is the period?
Like
Oh,
1000 turned to be in 2 years.
okay, okay. So 1,000.
1000
Okay,
turned to
before
be,
they started.
so they are not in the risk, they are actually in the disease. uh,
Okay.
okay, so they are
Therefore,
excluded.
Therefore, starting with 9,000 individuals at risk for Hep C at the beginning of the follow-up period, there are 200 new cases of Hep C over the 2 years, or 100 new cases per year. The number of patients with not Hep C who died during the follow-up period should be excluded from the analysis. The best estimate of the annual incidence will be 100 over 9,000 because 200 new Hep C cases have been diagnosed over the 2-year follow-up period. Huh?
You got
Wait.
it. Like
No, I got it.
10,000 IV drug abuser in the town A. We are looking for hepatitis C. 1000 already infected for hepatitis C. So we are subtracting 10,000 minus 1000. So 9,000 people are at risk. So we are dealing with the 2 years. We are seeing 2 years. In 2 years, we found 200 hepatitis C infection. So we for finding out the incidence, number of new cases divided by population at risk per year. They are talking about annual incidence. So 200
Mm-hmm.
case per year. So was 200 case in 2 years. So 100 case per year. And the population at risk is 9,000.
Okay. Okay. Figure. Okay. Do I read that one?
Yes, they are now figure 1 and 2.
Figure 1 and 2 demonstrate the difference between incidence and prevalence in the figure. Figure 1 contains two arrows demarcating. Which one is figure 1? Guessing this. Wait, this one. I'm guessing. Figure 1 contains two arrows demarcating the 1-year time frame during which the number of new cases is to be measured. You can see that 3 new cases have been identified during this period, making the annual incidence 3 cases per year. Okay. The 3 new cases have been identified during the, okay, I think it's the same thing. Prevalence of the disease is a measure of the total number of cases, new and old, measured at a particular point in time. You can conceptualize it as a snapshot of the number of disease individuals at a given point. You can also tell from figure 1 and 2 that where is it? That prevalence and incidence are related to each other. Prevalence is a function of both the incidence and duration of the disease. Diseases that have short duration due to high mortality, aggressive cancer, or quick convalescence, the flu, tend to have low prevalence. even if incidence is high. At the same time, chronic diseases tend to have high prevalence, even if incidence is low. Okay, so I keep going.
Okay.
Chronic disease treatments that prolong patient survival increase the prevalence of disease. Prevalence of the disease due to accumulation of cases over time. Incidence is not affected by such treatments because it measures only new cases as they rise. Increasing prevalence of a chronic disease despite stable incidence is usually related to improved quality of care and resultant decrease in mortality. Improved diagnostic accuracy for a chronic disease leads to both increased incidence, more cases identified, and prevalence. Primary prevention, Hep B vaccination, hepatitis vaccination decreases incidence of the disease, and in the case of Hep B vaccination, will decrease incidence of Hep D too, which requires Hep B co-infection, and also eventually decreases prevalence as patients with disease that predates primary prevention die, or I think your question 4. Jesus Christ, this is
Like question
okay.
4.
Okay, so we got question 1, question 3, and question 4.
Now question
Well,
5.
did I get question 4 right? Right, let me see. Question 4, question 4. Okay, I got incidents
Yes, you are
and
right.
then improve quality care. We didn't get the number 2. Okay, but question 5. What is it? Some specific measured diseases,
Like
measure
question
of
5
disease
is the crude mortality rate. This one,
through some
calculated by the
measure
dividing the number of the death by the population size.
crude mortality rate by number of deaths by the total population size. Wait, where is it?
Like
So
70 death and
do I have it right? No.
yeah,
Let's
70
see.
by 5,000.
Wait,
So it
it's
is,
like so we are calculating the crude mortality rate.
isn't it?
You said this is what we're calculating. That's what you're saying.
So, or no, 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 no. Sorry. We are
Oh,
calculating MMR, maternal mortality rate, in the last question 5. This one. Just
oh,
read this one, because if you start reading whole one, we will forget everything.
okay. Maternal mortality rate calculated by dividing the number of maternal deaths
By
by the number of
number of
live
live birth.
number of
So
maternal deaths.
70 by 5,000. So we have to remember this MMR, maternal mortality rate, number of maternal death divided by live birth.
Maternal death, what does that mean? That the lady gave birth and died?
Maybe,
Oh,
yes,
okay.
maternal death. Yes, the lady is dying.
Okay. Okay.
Okay,
Got it.
okay, okay, okay for today.